How's it going, everybody? So I'm here with my continuation of the cars sequence for today's Monday move. And we've worked our way down the arm, and now we're at the last joint, which is the wrist. Again, the idea is to make a circular motion or a rotational motion with just the one joint. So I'm going to lock the rest of my body in place, arm out to the side. I'm going to show you just one hand at a time, but you could, when you learn each side, you can move both hands at the same time. So, bracing into my abdomen, squeezing my glutes, creating tension through my body. I'm going to flex my wrist as much as possible, and without rotating, I'm going to move my wrist to the inside, all the way up to an extension, to the outside, and back down to a full flexion. Obviously, you repeat in the opposite direction, so out, up, in, and down. If you notice, I didn't turn my arm, and one challenge would be to set an eraser or a block on your forearm and try to do that move without the block falling off. Okay? The second variation for the wrist is to reverse directions or change the position. So my palm was down to start, now my palm is up. And I'm going to go back into that wrist extension, to the inside, to a full flexion, to the outside, and down. And then switching directions, outside, up, inside, and down. So again, both directions in two different positions. My other wrist I injured a couple weeks ago, so the difference between pre-injury and post-injury is pretty drastic. My range of motion is quite limited. I can't quite get to a full flexion or a full extension anymore. Whereas previously my left wrist and my right wrist were quite the same. But I've been using these controlled articulations to diagnose my wrist each day. And I've been noticing, slowly but surely, the range of motion is coming back. So challenge yourself if you like push-ups or if you like pressing things overhead and you can't get your wrist to a full 90-degree flexion, you might avoid putting pressure with your body weight on your wrist and forcing it to go there, i.e. handstands, push-ups. Rather, use a weight or a parallel bar and have your wrist in a neutral position until you gain the active range of motion that allows you to do a push-up without wrist pain. So I hope this helps. We're going to move into the body as we progress next week and get looking into the spine and all the segments between the vertebrae. And keep moving, make today legendary, and I'll talk to you soon.